Okay, so we're going to start talking about personal qualities in healthcare. So the first section we're going to talk about is personal characteristics. And that would be talking about appearance first.
What you'll learn. After you finish this lesson, you will be able to list principles for maintaining good health. Identify guidelines for dressing professionally. Name ways to manage personal hygiene. Personal appearance. It is important for healthcare workers to take pride in their personal appearance. They must practice healthy habits and wear professional garments. When healthcare workers present a positive self-image, patients are more likely to feel confident about the care they receive. Good health. One aspect of personal appearance is good health. Good health involves treating and preventing health problems. The following 6 items are principles for maintaining good health. Good nutrition. Eat well-balanced meals to provide the body with energy and nutrients. Regular physical activity. Exercise daily to develop muscle tone, maintain circulation, relieve stress, and improve emotional well-being. Adequate sleep. Get enough sleep each night so that the body is refreshed and alert for the next day's activities. Effective stress management. Learn to manage stress well to reduce the risk of stress-related health problems. Good posture. Practice good posture to prevent fatigue and reduce the risk of muscle strains. Avoid harmful substances. Avoid using harmful substances such as tobacco, alcohol, and drugs, which can damage body systems and impair judgment. When healthcare workers apply these principles, they increase their ability to perform daily tasks. In addition, healthcare workers who are physically and mentally fit are prepared to handle the challenges of working in a medical facility.
Okay, these 2 questions are used to check for your understanding. How does regular physical activity affect the body? It develops muscle tone, it maintains circulation, relieves stress, improves emotional well being, or all of the above. Okay, it's all of the above. Good health will increase a healthcare worker's ability to perform daily tasks. True or false? That one is true.
Dress requirements. Every medical facility has dress requirements for the employees. Healthcare workers must take special care to abide by the rules and to maintain a neat appearance. The requirements for dress vary by facility, but there are basic guidelines that all healthcare workers should follow. Uniform. Some agencies require healthcare workers to wear white, while other agencies allow colors. All uniforms should be well-fitting, clean, and free from wrinkles. Undergarments should be white or neutral so that they cannot be seen through the uniform. Clothing. Some agencies allow regular clothing to be worn in place of a uniform. Like uniforms, clothing must be well-fitting, clean, and free from wrinkles. In addition, healthcare workers must choose clothing that is appropriate for their jobs. For example, neat sweatpants may be appropriate for an athletic trainer, but sweatpants would not be proper for a medical billing officer. Shoes. Many facilities require healthcare workers to wear white socks and shoes. Some facilities do not have a color preference. All shoes must be clean and supportive. Sandals and shoes with high heels should be avoided. Dress requirements. Additional dress requirements for healthcare workers include name badge. Healthcare workers are required to wear name badges at most facilities. In some types of medical facilities, it is illegal to work without a name badge. Name badges usually display the name, title, and department of the healthcare worker. Many name badges also contain an identification photo. Jewelry. Jewelry is not allowed in most healthcare professions. Exceptions include wedding rings, small earrings, and watches. When jewelry is permitted by a facility, it should be tasteful and not worn in excess.
All right, check your understanding. Question number 3. Which of the following is the best description of how healthcare workers should dress? Neat, casual business wear, extreme clothing styles and bright colors, any type of clothing that is comfortable, clean, well-fitting clothes that are appropriate for specific jobs. Okay, it's the last one.
Hygiene. In addition to dress requirements, healthcare workers must be mindful of their personal hygiene. The following guidelines should be practiced by all healthcare workers. Personal hygiene. Healthcare workers must make every effort to control body odor. They must shower daily, use deodorant, brush teeth, and wear clean undergarments. In addition, healthcare workers must not wear strong perfumes, lotions, aftershaves, or hair products that may be overbearing or cause allergic reactions in patients and coworkers. Fingernails. Healthcare workers should keep their fingernails short and rounded. Long or pointed fingernails may injure patients or tear gloves. If fingernails are painted, the color must be clear or neutral. In most cases, acrylic fingernails are not allowed. Also, fingernails must be kept clean. Use a nail brush to clean under fingernails and remove all dirt and pathogens. Hair. Hair should be washed regularly and styled neatly. Extreme styles and flashy hair accessories should be avoided. If healthcare workers work closely with patients, long hair must be pulled back. Hair should never touch patients or block vision during procedures. Makeup. When makeup is worn, it must be natural and tasteful. Extreme or excessive makeup should be avoided.
All right, check your understanding. Question number 4. Some personal hygiene products have strong odors and may not be appropriate for healthcare workers. That is true. Extreme hairstyles and makeup are encouraged at healthcare facilities. That is false. Okay, this is an exercise where you have to place the items in the correct category. You have correct actions, you have incorrect actions. So wear your name badge. That will be correct action. You always have your name badge on because you need to be identifiable to staff, people at the hospital, coworkers, and for your patients as well. Eat well, balanced meal. That sounds like that's the correct action. Sleep as little as possible. That's incorrect. Wear sandals. They talked about that. That's incorrect. Wear supportive shoes. That's correct. Pull back long hair. That is correct. Wear strong perfume or cologne. That is incorrect. Use tobacco, alcohol, and drugs. That's incorrect action. Keep fingernails long. That's incorrect. Exercise regularly. That's correct. Wear makeup that looks natural. That's correct. Use deodorant. That's definitely correct. Wear tight clothing. That's incorrect. Paint fingernails with bright colors. That's incorrect. And we have all of these right.
Lesson summary. In this lesson, you identified guidelines for good health, appropriate dress, and personal hygiene. In this lesson, you learned that good health involves treating and preventing health problems. Healthcare workers must take special care to abide by dress rules and to maintain a neat appearance. Because healthcare workers come into close contact with patients and coworkers, they must be mindful of personal hygiene. When healthcare workers present a positive and professional self-image, patients are more likely to feel confident about the care they receive.